Hello, this is a presentation on drugs to treat non-HIV viral infections. So what are some concepts about antiviral therapy? First, our ability to treat viral infections still remains limited, and that's due to the fact that the viruses get a hold of the host cells and they reproduce based on your host cells. So it's difficult to suppress viral replication without doing significant harm to the host. And antivirals suppress biochemical processes unique only to that viral replication. So the first antiviral we're going to discuss is acyclovir, and it is only effective against members of the herpes virus family. So that includes herpes simplex genitalius or genital herpes, the mucocutaneous herpes simplex, which would be like cold sores, and then of course the varicella zoster infections. Unfortunately, the herpes virus has developed a resistance to acyclovir through changes in how it replicates. What are some adverse effects of using acyclovir? If it's used in IV therapy, you have this phlebitis, reversible nephrotoxicity, and neurotoxicity. With your oral preparations, you can have GI upset and vertigo, and with the topical, you can have stinging sensations at the site of application. Next, we have Valtrex. Now, Valtrex is a prodrug of acyclovir, so it can treat herpes zoster, which are shingles. It can treat genital herpes, cold sores, and chickenpox. It can also be used with immunocompetence for TTP. Next, we have famciclovir, and it is a prodrug used to treat acute herpes zoster or genital herpes infections. It is equivalent in effectiveness to acyclovir with minimal adverse effects. And again, because it's a prodrug, like I said earlier, with some of the other medications, as they develop new versions of a drug or a new drug, they usually try to improve on the side effect profile. There are also topical antivirals. For cold sores, we have Denavir and Abreva, which you can also obtain over the counter. Then we have for ocular herpes infections, we have trifluridide and ganciclovir, which are used. Now, those will be prescribed if you work in ophthalmology. Next, we want to discuss the management of influenza. Influenza, of course, is a serious respiratory infection that hits during the winter, early spring months. It's a major cause of morbidity and mortality worldwide. It is caused by type A, which is more infectious, and a type B influenzas. And one of the issues, of course, is that it keeps evolving. Every season it comes out, there are new strains of these type A and type B viruses. So how do you manage the flu or influenza? By vaccine is the primary strategy, and then you have drugs to help if you've been exposed or to help lessen your symptoms. The vaccines are changed yearly based on the strains And it's always important to know that the strains they use, of course, then will be the strains from last year. They don't know what is going to be out this year. They can only predict it on last year. So hopefully the new vaccine will cover some of the old strains that may reappear um, this new season. So there are two types of flu vaccines. You have inactivated, and then you have live or attenuated. Your protection begins 1 to 2 weeks after vaccination, so it's not immediate, and it generally lasts for 6 months. So it should last for the duration of the flu season every year if you get your shot in October, November. There is a small risk for Guillain-Barré syndrome when receiving the flu vaccine. And what are some of the precautions or indications? You don't want to get the flu shot, or you won't be given the flu shot if you have an acute febrile illness. A minor illness with or without a fever does not preclude you, and egg allergy does not preclude you from getting the vaccine anymore. So the drugs for the flu, and these are drugs if you have exposure to the flu, or you start, and you can take this immediately within the first couple of days of flu symptoms. You have Tamiflu, which is a capsule, and you have Relenza, which is an inhaled, it comes in a diskette, and you do an inhalation of the powder daily. You also have the amantadines, so you have Simitril and Flumandine to take if you aren't able to take Tamiflu or Relenza. The ribavirin is also inhaled, and it's a broad spectrum antiviral that's used for RSV infections. And you also have Synergist. And Synergist is given to newborns to prevent RSV. It is an injection that is given monthly. It is a very costly injection. It's around $10,000 a injection per month, and the infant will get that for several months, depending on the time of year that they're born. So now on to patient is prescribed acyclovir by mouth. What would you look for as an adverse effect associated with oral acyclovir therapy? And the answer would be B, nausea, vomiting, diarrhea. Question 2. The patient asks what he can do to prevent influenza. What should the nurse do? The best answer here is to instruct the patient to obtain an influenza vaccine. All the other ones can be helpful. Of course, hand washing is very important. The patient can opt to wear a mask in public places, especially at the height of the flu season, because windows are closed, people are staying indoors more. You can teach the patient about antiviral medications or for the influenza in case they know they have an exposure or if they start to get symptoms, but the best protection is to get the vaccine. Question 3, what statement about Tamiflu does a patient identify as true? And that's C, it can be used to treat or prevent influenza. And question 4, last question, the patient has been prescribed Abreva cream for herpes of the lip. Which statement will the nurse include in patient teaching? And it's D, you apply the cream at the first sign of reoccurrence, which makes sense. And that is it for this presentation. Thank you.